Hello, everyone. Welcome to CDO Magazine series of one-on-one interviews with chief data officers, data leaders, and other key influencers. I'm your host, Jon Kimerle, Global Strategic Healthcare Alliances Leader at Pure Storage. I come from a fairly extensive healthcare background, so I'm very excited to be interviewing Shahidul Mannan, CDO at Bon Secours Mercy Health. Welcome, Shahidul, and thank you so much for your time.
Thank you, Jon. Excited to be here and looking forward to the conversation.
Yeah, as I took a look at your background, it's in some ways reverse of mine, where I spent almost 30 years on the provider side, and now the past 3 or 4 with Pure Storage, a data solutions vendor. And as I look at your background, the past 5 years has been in healthcare, and the prior is very diverse: consulting, financial services, and also with some manufacturers. So looking forward to your perspective. Well, I go ahead and start with the first one, really just setting the context. 5 years ago when healthcare, the chief data officer probably wasn't as prevalent as a title, and now it's almost the de facto standard. So maybe talk a little bit about how the CDO role has evolved, both in healthcare, and then contrast that a little bit with your experience from the other industries.
Sure. Thank you, Jon. And you're spot on. I think the healthcare is now emerging and evolving around digitization and becoming more data-driven and innovation with data, AI, all the good stuff. And it's been pretty recent, rightfully so, rightfully mentioned. I think now the role is getting established across industries, how the chief data officer is focused on not only technology, the backbone for data and architecture, but also, and not only compliance and data governance, but also on innovation, and also on focusing digitalization with data. That's how I see the path forward as well. And in terms of my background as well, I've been in technology for almost 20 years. Most of it has been in data analytics and focusing on AI-driven various applications now and innovations now. And spend a lot of time in financial, obviously. Financial and fintech took probably leap into data some time ago, and healthcare was a little behind because of the regulatory environment that we are in, and some of the technology adoption and digital capability development at the core that was kind of pending. But now that we have those bases pretty much covered across, for the most part, with the ACA Act coming in and then going digital with EHRs and now with telehealth, we have enormous footprint of data, and it's only increasing. We are still scratching the surface. So this is a great time to be a chief data officer in healthcare, where not only we focus on technology and compliance and regulatory issues, but a huge focus on innovation with data.
Mm-hmm. Well, I sometimes joke about, I'm very familiar with a lot of some of the data problems within healthcare because I helped create them. But whenever we did any type of analytics project, and it wouldn't even have to be very complex. It could have just been an executive dashboard measuring, performance. The senior leaders were pretty good at identifying at a high level what the key measures they wanted to measure. And then they could also react on the way it would be presented, like how it looked in the dashboard. But, there's a tremendous amount of work between those two, where all the data quality and data silos. And so interested in your view of that kind of perennial problem. There's fantastic tools that are now being able to be deployed at scale, but do you see some of those data quality issues, and what are some of the initiatives you're focused on to bridge that gap?
Sure, yeah. I think data quality is a issue wherever there is data and across the industries. And in healthcare, we certainly feel it a lot because we have such diverse sources of data, so much unstructured data, from doctor's notes to images to CT scans and whatnot, genomic data now coming in. So that also, obviously makes us more, I think, focused on how we manage the data, ensure the quality, make it authoritative. So there are few aspects to it. One that you mentioned is certainly there are siloed data problems. We have so many systems that are not integrated. Interoperability has been a challenge and still a challenge in healthcare systems, across healthcare systems. So that is one area of focus. And then once you eliminate the barriers to some extent, have the data in one place, how do you ensure that data is of high quality and authoritative and actually usable? Because anything and everything we do with data, it's always garbage in, garbage out. Your AI can be as good as your data, what you have trained it on. So for that, the biggest initiative we have, and we are in that journey, is we completely restructured our architecture and technology stack and went predominantly into cloud with building our data lake and almost 15, 16 emerging technologies combination to build that authoritative, trusted data asset, where not only we can combine and source from variety of data at very high volume and at speed, near real time or real time streaming, and then we can integrate it and also service and deliver it with variety of use cases, from traditional performance reporting that you mentioned, which is our bread and butter and will continue to be, to becoming more AI-driven application development, alert system for patients, health check, or efficiency systems for supply chain. All these various use cases can be enabled from these data assets. So it can truly be data-driven from reporting to application to your AI-driven various use cases. So that's the journey we are in. And I think that's the future, as everything is merging and data is at the pivotal point of all of this.
Back when we, at my previous employer, when we deployed the electronic health record, our number one concern was clinical adoption. It was, back in 2005, 6, it was before the advent of high tech and some of the incentives. So we weren't necessarily early adopters, but it was before, the early majority. And so clinician adoption was a big thing. And one of the strategies was to give the clinicians many different ways to do their workflow. But that means that the data is in many different places, many different formats. And so when you go to pull it back together, it becomes challenging. So some of these, it's kind of a workflow technical debt that's not easily solved. So in my previous role, we looked at Gartner quite often for just a kind of a touchstone to make sure that we were framing things appropriately and thinking about our thinking in a standard way. And Gartner talks about data literacy as the ability to read, write, communicate data in context, including an understanding of the data sources and the constructs, the analytical methods, all the techniques that are applied, and the ability to describe this in a use case application, ultimately resulting in value. To what degree are you looking at that model or concept with Bon Secours Mercy?
Sure. Yeah, excellent question. I think evangelism is a big part of the CDO role. And that involves what you just touched, the data literacy across. That is the key ingredient for building a data culture and becoming more data-driven. Because it is always a combination of people, process, technology, and then culture kind of ties them all together, right? So it is spot on that we do need to do that as part of our role as we build our strategy, as we think of use cases, as we think of adoption. All these can be successful if the people and the culture has that literacy, the understanding. So one part is adoption. That as we build, we want it to be used, and we want the decisions to be made driven by data, and we want to build applications that can improve patient care, that can improve the quality of healthcare, make things efficient. So adoption is big, and for that you need everyone to be aligned with the strategy, understanding what the implications are, and actually use what you build. The other part is innovation, and on that part, if you think about it, we as a central data body, or my organization as a central data body, or even people who are in specific digital health centers, cannot do all the ideation, cannot be the genius of all innovation.
Right.
It needs to come from the fields. It needs to come from the physicians, from nurses, from the practitioners who sees patients and operates day in and day out in this field. And they generate the data, they use the data, and they actually feel the pain. So a lot of innovation ideas are more effective when it comes from the field level. And in order to make that happen, you need to build that data culture so they can connect the dots and say, hey, in this space, data can create something of value. And that's why the data literacy and evangelism goes so far that it actually is something we also support with self-service analytics. So you know the problem, why don't you try it with some of the data that we are enabling with? And if it sounds like a great use case, let's have that talk the technology, talk the other things, and make it a production grade application that can then be applied. So both the adoption and innovation side is extremely, I would say, dependent on data literacy.
I was on a panel talking about cybersecurity, and within a healthcare organization, you would expect every leader to be able to manage their budget, have some basic managerial, accounting, finance type skills. That's like a given. I was basically arguing that leaders should have managerial understanding of cybersecurity, and data literacy is the same thing. There's a base set of skills, really even beyond just the leadership level, that the degree to which they are understood, appreciated, then it'll unlock that innovation. So it makes a lot of sense.
Thank you.
And you touched on the self-service aspect of your delivery model. Back 5-10 years ago, the demand was infinite for reports and other analytic tools, and so the key was to figure out which ones would add value, and self-service was a big part of that. The landscape has changed quite a bit with cloud technologies that don't require teams of people to deploy. So how are you enabling self-service while maintaining security, compliance, all those things you just have to do?
No, excellent. It is a complex ecosystem, and being in the healthcare data, very well, with your long experience in healthcare, how sensitive our data is. And as a custodian, it's our fiduciary duty to ensure not only we be compliant with HIPAA and all the other regulatory bodies, but actually ensure the patient privacy and guard the data well, and balance it with innovation to improve patient care as we do that. So the way I'm approaching it, the strategy is we build that data ecosystem where we bring the data in very much enabled with various types of technology and use cases. But then we also provide more like what I call experiment environments for our various constituencies. So we have the central mothership of data, innovation, and analytics hub, but then each of our business areas, small or large, depending, have their own small scale environment where they can experiment, they can quickly deploy something, bring in their data and experiment at their will. And it helps with the innovation, because a key mantra of innovation is and then move on. So you don't want to come up with an idea and then go to the central body and wait 6 months for it to happen. Right. Sure, you have the budget and everything, right? So we want you to experiment it, and within a week you'll say if it works or it doesn't, and then we can have a talk for a larger grade production, grade application development or project work. So that's how we are doing the self-service. And you can think of from a technology perspective, I have the data lake and the cloud-driven analytics ecosystem around it, which is managed by the CDO organization. And then I have enabled the self-service small pond-like data ecosystem for various groups who then uses it, manages it on their own, and we only provide support for their innovation until they find that it is a high value use case. Then we all work together and move it to production.
Thank you for your time and insights. There's a couple things that I learned and focus on, and the discipline that you and your team put around innovation was definitely one of them. It's it is a discipline, and you can create environments where much more agility and ability for innovation to be lifted up. So appreciate it and look forward to connecting in the future.
Thank you, Jon. Absolutely. It's been a pleasure. And I think you covered so many interesting areas and really enjoyed the conversation, and looking forward to seeing you in Boston.